Within a hospital, there are hundreds of people working behind the scenes. When you first think of healthcare professionals in a healthcare setting, most people's minds go to doctors or nurses. However, there are so many others working under these people to ensure the safety and well-being of their patients. These include certified nursing aides, or CNAs for short, that work beneath nurses, performing what many would consider dirty work. Today, I'm going to be addressing these CNAs and bringing to light what they do and what it takes to be in their position. I will be talking about the requirements of being a CNA, the CNA exam itself, and the responsibilities of a CNA at work. I personally took a 3-year course through my high school to become a CNA and worked in a nursing home in the position for a year during my senior year of high school. Firstly, the requirements of being a CNA, while less extensive than a nursing program at a university, of course, are rigorous. You must be at least 16 years old, be in sufficient physical health, pass state criminal background checks, and complete a training program. While there is an accelerated program of 3 to 4 weeks, the typical length of a program ranges from 6 to 15 weeks. This usually accounts for 75 hours of lectures and 25 hours of clinical experience. Clinical experience includes going to healthcare settings such as nursing homes or hospitals to work with real-life patients. These lectures focus on the aging process and restorative care, infection control, basic nursing skills, mental health, personal care, communication, residents' rights, data collection, role and responsibility, the disease process, and overall safety according to mass.gov. Personally, the program at my high school spanned about 3 years with an 80-minute class period daily, with lab and lecture alternating days. The first semester of our junior year, we went to the nursing home across the street from my high school for clinical experience. This allowed for my class to fully understand and prepare for the CNA exam that we took at the end of our junior year. The CNA exam consists of a written and clinical portion. The written portion has 60 questions and you have 90 minutes to answer them. Common topics include injury prevention, residents' rights, basic nursing skills, role of the nursing aide, etc. Furthermore, you are required to know skills such as documenting care, hand washing, indirect care, donning and doffing PPE, placing a resident on a bedpan, dressing and undressing a resident, hair care, foot care, collecting a urine sample, taking vital signs, perineal care, positioning a resident, denture and mouth care, transferring a resident, nail care, range of motion, feeding a resident, catheter care, and bed making. However, you are only required to perform 3 given to you by a registered nurse or nurse practitioner that grades you based on your competence while performing the skill. Everyone is also expected to perform the skill of hand washing. I personally performed taking pulse, foot care, and positioning a resident. A classmate of mine, who has now worked as a CNA for 2 years, performed catheter care, range of motion, and took respirations of a resident. This classmate now, who has worked at Life Care, a nursing home in Plymouth, for 2 years, has told me that everything we were required to know for the exam is used in her daily work working in a real-life setting. This includes turning and repositioning bedridden patients, taking patients' temperatures, blood pressure, and other vital signs, answering patient call-outs, documenting patient health issues and reporting to nurses, feeding patients, measuring and recording their food and liquid intakes, cleaning rooms and bed linens, helping with medical procedures, dressing wounds, bathing patients, combing hair, shaving, caring for nails, working with Hoyer lifts, and more. This is what I experienced in the 1 year that I worked at Newfield House, a nursing home in Plymouth. CNAs are expected to show up for their typically 8 to 12 hour shift dressed in clean scrubs, which I am wearing right now. Overall, although CNAs are placed through a rigorous training program, must take a stress-inducing exam, and have tiring days at work with numerous responsibilities, the job remains fulfilling due to the ability to care for those who cannot care for themselves. Thank you for all those who listened for their time.